Okay, this video is what's the difference in cure rate of conventional versus vegan treatment for chronic disease? And that's kind of one of the whole points of this talk. And, if you've been studying nutrition, health, and disease the last, more than the last year, it should be obvious by now. You should be very skeptical of conventional medicine whenever the topic is chronic disease. Because by definition, conventional medicine defines chronic disease as uncurable. So what they're basically saying is, we can't cure you. We can't cure you. All we can do is give you pills every day the rest of your life or do a surgery on you. So then you say, well, is there any other choice? Even looking at mental illness, schizophrenia. If you read about soteria, deliverance, in the Greek definition of it, just by putting patients in like these apartments with some residential advisors that weren't even that skilled, they were just nice to the patients. The vast majority of the patients recovered from schizophrenia. You can look it up for yourself. There's entire books on this subject. There's videos on it. Lauren Mosher was one of the head guys, researchers, physician, psychiatrist, and he actually got in trouble for it because they didn't like the fact that he proved that non-pharmacological therapy is better than pharmacological therapy for schizophrenia. I realize there's going to be some exceptions and there's going to be acute cases, acute psychotic episodes that are different, but look at diabetes. Pritikin, Kempner, McDougall, Roy Taylor, and many others, Bernard, they routinely cure type 2 diabetes. If the patient follows a low-fat, low-sodium vegan diet, they're routinely cured. Okay? The more chronic it is, they'll eventually lose pancreatic function, of course, but you can never cure diabetes with a pill. Hypertension. The medical textbooks say 90-95% of it's essential. Nobody knows what it's caused, but that's BS. We know that if you don't eat enough potassium, you're hypertensive. Also, you eat too much sodium, too much fat. And Kempner had thousands of patients that are cured. Richard Moore, McDougall, Pritikin, you name it, one after another. Tons of hypertension patients are cured. The sooner you get the diet together, the better. The more chronic the disease, the more likely the arteries have lost their elastic fibers, like the ascending thoracic aorta, and the other arteries are scarred in with thickened capillary basement membranes, vascular smooth muscle hypertrophy, and whatnot. So the sooner one gets their act together, the better, but it routinely cured in the early phases. Okay, coronary artery disease, Esselstyn, 198 patients in a row followed the diet, and lots of other doctors like Ornish and others have had great results with those. Impotence. Now, the data on impotence is not as extensive, but there's tons. You talk to anybody who's had patients go on vegan diets, lots of patients will have restored erectile function or improved erectile function. Not everybody, but a lot of people. If you're going to go to a medical doctor, they'll give you pills like Viagra, for example, or related drugs, or potentially put in a penile implant. But, that's a big surgery. You might as well fix it if you can before the arteries to the Johnson, like the pudendal arteries, occlude. Obesity. Mediterranean diet, it stinks. It doesn't work. It's high-fat diet. Bariatric surgery can work quite well, but there's also a high risk of side effects. I've seen a lot of side effects from that. There's a risk of recurrent obesity. Garth Davis wrote about that. He's a bariatric surgeon, that his patients would routinely, after a couple of years, start recurring in their obesity unless they also improve their diet. Arthritis. You eat the healthy diet, you're much more likely to obtain a good body weight. You'll also simultaneously, when you avoid all the meat and the oils, the processed food, dramatically reduce your amount of inflammation. This can take the edge off the pain. You improve blood flow to the joint. You improve blood flow to the nerves that supply the joint, like diabetic neuropathy, for example. It can dramatically improve with an improvement in diet. You get an improvement of blood flow and less insulin resistance. Dr. McDougall wrote a famous essay called "Diet is the Only Hope for Arthritis." Autoimmune disease. You got a chance to cure it. Quite often it's due to leaky gut. You start eating a high-fiber diet, avoid the processed food, the meat and the oils, and some other things, carbon filter your water to get the chlorine out, etc. There's a few other things you can do to avoid. And you very often reverse it. And isn't that 1,000 times better than having to go on these powerful immune-suppressing drugs? Maybe you need that, but why not try that first? Look at Roy Swank's data with the multiple sclerosis patients. Cognitive impairment. It depends how severe it is, but if you got mild brain fog and some difficulty concentrating, that often can improve a lot if you get your act together in terms of diet, nutrition, and avoiding toxicology type stuff. Cancer is much more complicated. No one's ever going to fund that research, but there's anecdotally reason to believe that the vegan diet can help a lot. But, that's a whole other ball of wax. We're not going to get into that today. But anyways, my point was, if you just walk in like a trusting, ignorant sheep and, go to somebody who only knows pharmaceuticals and doesn't know diet and toxicology, you could be stuck on pills the rest of your life and have that disease for a prolonged amount of time, more than 5 years or whatever, till it becomes irreversible. So it's good to be aware that quite often this is the way. The way you look for any disease is ask yourself, is there any country in the world where this disease is rare? Why is it rare? Are there other countries? What do they have in common? And quite often that'll lead to the answer.